Salamun alaikum. Hello, how are you? Namaste. Hole. How's everything with you today? I know today some of our Muslim midwives, they had Eid al-Fitr. Happy Eid to all of you. And I hope even if you are not Muslim, with any religious, the happiness comes to your life. Any time is the best time to be happy. Every moment, if you be happy, is Eid. So happy Eid to all of you. I hope you enjoyed your day, and I was getting very lovely, fantastic, brilliant message from all of you. Thank you for your love. Thank you for your support. Thank you for connecting us in YouTube channel. I see day by day you are coming and interacting and share your query plus your comments. It is so lovely to hear from you, because we will understand what is needed and which topic you are interested, that we focus on that more in our training and sharing our experience and knowledge. We were talking about antenatal cleaning, and after that, this is the second courses that we are talking about preconception counseling. We talked in our previous class that how different countries managing preconception counseling. Some countries, they have some primary health care, some countries they have some pre-marriage counseling certificate, and some countries they have independent midwifery clinic, just they focus on that. But what we were talking about, it was about what is WHO protocol. In some countries and in some developing countries, we need to work on that more than others. Because if we can start preconception counseling, we can reduce many morbidity and mortality. Sorry for suddenly we lost our connection. Anyhow, it's okay. It is lovely color now. It is like night. So I will continue about the topics we were talking about. That we were talking that how different countries they are managing their preconception counseling through their clinic, health center, training in the school, or pre-marriage certificate before course accreditation. Some other different protocols and policies they are trying to administrate in their countries to reduce this maternity mortality rate, and unfortunately some of our maternal diseases. So what is the important things that we have to consider about that? As a midwife, we have a very big role. We have a very necessary job description in this field, especially in some rural area in developed country. As I shared before some videos from what I'm doing in some India villages, it's very, very important to go and try to train about this important basic hygiene and fertility training. As you know that we are very welcoming mothers and girls to learn about awareness and understanding our fertility and infertility and their preventable and unpreventable causes. Sometimes it's not very clear for them. Sometimes they are not that much sure what is the diseases that they have to come and refer to the doctors or midwife. So it is the role of midwife to aware mothers, train them, and then understand the needs for that. Yes, it is one of our important role in our preconception counseling to diffusing stigmatization of infertility and assumption of faith, plus screening and diagnosis of couples following 6 to 12 months of attempting pregnancy, and management of underlying causes of infertility or subfertility, including fast STI. Most of them, they don't have idea about what is STIs. Yes, STI, it has some signs, but sometimes the couple, they don't have any sign about that. how we can recognize, how we can estimate the screening by educating the girls, boys, and family in those places. We should talk about importance of screening. We have to talk about the symptoms that both couple would see, and they have to investigate in proper way. Have you ever seen about STI, about any advice regarding collecting some specimen from men's penis? Yes or no? In your place, I want to know. Yeah, because in some countries, this is mandatory to collect some specimen from penis of the male. So in some countries, it still is not that much clear. It's not obvious that it's necessary to find STI culture. But we have to explain to the lady, we have to explain to the girls that who's coming to you, that how she found in her partner symptoms. If some changes in the skin of the genital of sex partner, or found some discharge, bad smell, or pain on suprapubic pain, they have to come to midwife and they have to get preconception counseling for STI. The other important issue about STI we have to consider of that is that to explain and make it as an important investigation that they have to consider routinely every 3 to 6 months for a lady, for a mother, for a preconception, for expectant mother. Even during pregnancy, they have to go through this investigation for checking for Streptococcus B and for some Klebsiella. We have to collect some culture, and we should collect some swab from the vaginal discharge around of the cervix. It is completely different by pap smear. And all of the midwives, they have to explain the importance of that and try to facilitate this cultural specimen collection alongside arranged with lab test groups. The other important role of us is counseling for individual couples diagnosed with unpreventable causes of infertility or subfertility. Yeah, it is very important because sometimes some couples, they have attempt of 6 to 12 months for pregnancy, but they are not getting pregnancy result. They are not getting conception. So we have to screen. We have to diagnose. After STI, what is the reason for that? Maybe they are not going through proper sexual relation. Maybe the time that they have intercourse is not proper time. Maybe the technique that they are going through that is not proper techniques. So we have to investigate. We have to focus and try to evaluate how's their sexual relation together. Sometimes there is other reason behind that. There is some genital problem. Sometimes there is some history of some medication, or sometimes history of some diseases like diabetes, like hypertension, or other problem. And even in some couples with the history of depression, we will find this infertility and postponing the fertility as well. The other reason behind that can be the psychological mood, and it can be according even the time of their life. Sometimes they are engaging with some stressful lifestyle issue. So there's many issues behind that we have to give in our preconception counseling. We have to consider some other things like screening for substance use. We have to providing brief intervention and treatment when needed. and treating substance use or disorders, including pharmacological and psychological intervention, and providing family planning assistance for families with substance use disorders, including postpartum and between pregnancies. As I mentioned before, we have some other psychological issues that is behind them, like their family problem or the place that they are living and their political issue they are engaging in that time. We have to establish some prevention programs to reduce substance use in the adolescents. It can happen during their school time and reach to the universities. The other important screening test, the other important prevention and providing preconception counseling is going through proper vaccination against rubella, tetanus, diphtheria, and hepatitis B. In some countries, we have some special vaccination that you have to consider according country protocol. The other important thing that we have to consider about that is about discussing and discouraging the practice with the girl and her partner about her pregnancy, or about her even if she's young, she's not married, about her some genital issue. For example, she has some discharge. We have to explain screening woman and girl for FGM because we have to detect complication. Sometimes they are not informed well. We have to inform women and couples about complication of FGM and about access to treatment. And carrying out defibrillation and seals girls and women before or early in pregnancy. Sometimes there needed some removing cysts and treating other complication that is very common in the girls. We have many polycystic ovarian diseases. We had many other ovarian cyst issue that is better we explain to that and train them how to treat. If it is needed as a surgery process, we advise them to go through that referral system. The other important things is that we have to consider is about environmental health. Have you ever thought that how much environmental health will affect in our conception? It's very important because if we can provide some guidance and information about this environmental hazard and prevention, it can be very helpful. For example, for some countries, in some capital cities, we have so much big pollution that is caused many malformation in the fetus. And we have some other issue in environment, like some places there are so much noise and there is no patience and no quiet in that places. It affects on psychological health of mother, and before conception it causes many psychological disorder as well. We have some others, unnecessary pesticide use, or sometimes providing alternative. We can try to provide some alternative instead of that pesticides, and we can try to protect them from lead exposure. It's different that how we can use these exposures. Some other important issue that is about the mercury in some fish, that some countries they use some fish in their diet. It is include methyl mercury. So about those fish that they are considering in their daily diet, we have to check and consider which kind of fish include that, and we have to inform others, try to reduce use of that kind of fish. The other important environmental health is promoting use of improved stoves and cleaner liquids like gaseous fuel and something like that. Maybe it's these very simple things, but sometimes they cause too much effect. As you know, protecting from unnecessary radiation exposure in occupational, environmental, and medical setting. It is very important. Maybe for some urban area, it is completely clear. They understand and they avoid that. But in some rural area, still they are not sure about that. So I hope we can come through that and know the importance of our midwifery job. We have to know that every place in the world needs midwife. In rural area, we need some midwife just to make this role as an awareness training. And in urban area even, we need midwife. In other help, like institutional birth, being as a help for optimal birth. And sometimes we need midwife in other places as a family health midwife. Midwife has many big variety of role and job, and they can go through different idea to help the women and the girls. Try to think about that. Midwifery is creating job. Midwifery is being entrepreneur. Midwifery is a skill that makes you to interact with society. You are job creator. Don't forget, as a midwife, just to come through that. And I hope we can join together. We can help each other and make the world the better world for everybody. And it can happen with the help of midwife. Thank you everybody for joining me in this session. Please, if you liked our classes, if you have any comment or any suggestion, don't hesitate to share with us. We love your comments every day. We have different admin that are checking all of your comments and all of your suggestions. We go through that to help to each other. I have some experience after 20 years of working in different countries and different culture, from Europe to UAE and Iran and in Asia. So I try to share some of midwifery tricks and tips that's happening in working in different countries, in different culture. As much I hear from you, I can share with you, and we can find solution for our midwifery job role in different country and different culture. Thank you so much again. Happy Eid al-Fitr. Eid al-Fitr Mubarak. Thank you so much, and don't forget to follow us in our YouTube channel, Lily Mom Center LMC. Please don't forget to subscribe and do like. Thank you so much. ممنونم عزیزانم. شب خوبی براتون آرزو میکنم. شب خوش. خداحافظ. Bye. See you. Adios.